So I'm really excited and thrilled to sort of kick off the afternoon session. We've got a great lineup between now and about 4:30. And we're going to start with a team presentation looking at the identification and treatment of autism spectrum disorder with, I'll let you do the introductions. Okay, all right, Melissa, thanks.
So thanks everyone for letting us join you today. I'm Melissa Long and I'm here with my hiding psychology colleagues back here, Dr. Leandra Godoy and Dr. Amanda Hastings. Oh, thank you. I got it.
That's you.
Perfect, okay. And we are here to talk about enhanced support to primary care providers in the identification and treatment of autism spectrum disorders. We're actually representing quite an interdisciplinary group from Goldberg Primary Care within Children's, our psychology department, the Center for Autism Spectrum Disorders, and the Child Health Advocacy Institute. It turns out that improving access to autism care and improving health equity requires quite a lot of collaboration. We have no disclosures. You'll be hearing from each of us today. And we really, in our short 25 minutes, have just one learning objective, which is to describe resources and innovative practices that can aid primary care providers in better identifying and managing children with autism spectrum disorders. Throughout the presentation, you may see these little icons. There's a backpack, which will be an indication of a resource or a website that you can refer to after this talk, and also a light bulb for any food for thoughts or tips or things that we thought you might like to know. So we'll just talk for a few minutes about the scope of the problem to make sure that we're all have a shared understanding of the foundation for this work. So autism prevalence is growing. Now 1 in 44 children are diagnosed with autism. Screening in primary care setting is advocated by the AAP, and I presume many of you are doing this in your practice, but also imagine that many of you are facing growing challenges with how to connect families to timely and high quality services once an autism concern is identified. So this graph on the right reflects the number of patients referred to the Center for Autism Spectrum Disorders at Children's each year since 2016. And you can see that not only has the raw number increased from fewer than 800 per year to over 1,400 per year, but that there was a particularly sharp increase between 2020 and 2021. And the wait list for an older child is now up to 2 years, which unfortunately is not uncommon as we look at other specialized centers across the country. We also know that referring patients for further care once an autism concern is identified is anything but straightforward. The diagnostic piece alone is a challenge given variables in insurance coverage, wait times, et cetera, but many of our patients face additional barriers to care. And in particular, we worry about families with low health literacy or for whom English is not their primary language, and for families who have Medicaid insurance. Other notable inequities include that Black children and children with Medicaid insurance are more likely to be diagnosed much later than white children or children with commercial insurance. And Black and Latinx children have less access to evidence-based autism services and treatments even once diagnosed. And this picture at the bottom is a care map for a single patient with autism, mostly just to remind us how many different pieces are involved in the care of a child with autism, and this represents sort of medical services, developmental services, school-based, legal, financial, everything that's just one patient, one family navigating on behalf of their child. So we're going to talk a little bit about navigating resources, and then I'm going to turn it over to my psychology colleagues. We're going to talk about an ECHO autism program and then also integrated autism evaluations within primary care. So we wanted to start with the services that Children's National offers for patients with neurodevelopmental concerns. I started working at Children's in 2012, and it wasn't until just a few years ago when we started this interdisciplinary collaboration that I feel like I finally had a slight grasp on exactly where kids could go for services and what ages and what insurance and for what types of evaluations. So one of the things we've done as a group to try to improve access to care is to have a landing page at Children's National where you can refer to each of the different clinics, and it should describe what services the clinic offers, how to contact the clinic and schedule an appointment. If there's an intake packet, there's a link to it or information about how to access it. And then it reviews insurance coverage, and we're working hard to keep this up to date. So hopefully this is a good resource for you and your patients. And then taking a closer look at the different clinics, I just wanted to walk through sort of the options for autism diagnosis at Children's. So I was going to start in the middle actually with this child development clinic. So it's staffed by developmental and clinical psychologists, and they see children from birth to age 3.5. They perform developmental evaluations assessing cognitive, language, motor, adaptive, attention, and social emotional functioning. They do perform autism evaluations, including use of the ADOS. And next, we have our neurodevelopmental pediatrics clinic. This is staffed by developmental pediatricians or nurse practitioners, and they see children from birth through early adulthood. They do evaluations for delays in development, as well as provide treatment and medication. And some providers will do an ADOS, but not all. Some will refer a patient on to PSYD for a more formal diagnostic assessment. And importantly, they do not provide comprehensive IQ testing or neuropsych evaluations. And then lastly, we have the Center for Autism Spectrum Disorders, or PSYD. They are a multidisciplinary group, including neuropsychologists, psychologists, speech and language pathologists, psychiatrists, and more. They see kids from 12 months through early adulthood, and they perform both standalone and multidisciplinary assessments. They definitely do autism diagnostic assessments, including the ADOS, and also have some individual and group therapy available. So since even in the best case scenario, a patient will often be waiting months for a formal diagnostic evaluation for autism, we wanted to remind you of the critical importance of referring young children, especially simultaneously, so at the same visit that you're referring for a diagnostic evaluation, for early intervention services, audiology, speech therapy, and occupational therapy. We know that early intervention in these areas can make a big difference for their developmental outcomes. You can also encourage the family to access care coordination through their insurance provider, as often navigating all these different referrals at once can be a challenge. We've had some studies in our sort of interdisciplinary work looking at how much care coordination it takes to help families with autism. And when we've had a care coordinator involved, they've often worked with a family for more than 9 months to get them connected to needed services. Strong Start is our early intervention program in DC and specifically does not do autism evaluation. So it's important to let families know what they can and cannot expect from the early intervention program. Obviously, they can still get connected to developmental therapies that the child qualifies for. And for older children in school, you can simultaneously refer for an educational evaluation or classification of autism at the same time that you're referring for a medical evaluation, but it's important to note that it doesn't take the place of a medical evaluation or diagnosis of autism in the eyes, especially of insurance providers who may be authorizing ABA services or other specific types of therapies. Oh, sorry, I could have been progressing through those. All right. So tips for navigating referrals and wait lists. So as we'll talk about in a few minutes, we hope that in the next few months to years that pediatric primary care providers who are interested in increasing their scope of practice in this area with support from echo clinics or from integrated mental health practitioners, that you may be able to acquire the skills needed to more confidently give a diagnosis of autism for certain children. But in the meantime, there may be situations where a child has an educational classification of autism, and while waiting for a formal medical diagnosis of autism, a pediatrician might consider writing a letter of medical necessity for ABA therapy. And this is just an example of such a letter that may suffice in these situations, again, while you're awaiting formal medical evaluation. And I know that many of you, I think I saw the poll early this morning, do not practice in DC. So this may not be as relevant to you, but we have an autism spectrum disorders toolkit for primary care providers that we wanted to let you know about. The link is here, which just walks through navigating screening results with families, gives suggested language for talking about referrals, has referral algorithms, and then also some practical resources you can give directly to families around IEP 504 plans, and also information about SSI and Katie Beckett waivers. And then the DC Autism Collaborative has been hard at work preparing documents for healthcare providers, early education providers, and parents that may be of use to you in your practice. There's a Children's National landing page for these resources, and they're actually growing by the week. There's a couple more that are going to be added soon around the DC Medicaid MCO processes and guidelines for kids with autism. And there's also a link here to mental health and developmental screening tools that might be a good reference if you're looking for autism-specific screening tools beyond the MCHAT. For example, if you were looking to screen in an older child. And then lastly, so tips for talking with families. We know that these conversations can be difficult when an autism concern comes up during a visit. These are some specific recommendations from the Autism Speaks program about effective communication with families. So most importantly, you want to make sure that the family leaves with a shared understanding of your concerns, of the goals, and of the next steps. Using the word autism specifically can often be really helpful to draw attention to your concern and offers an opportunity to describe how autism is different from developmental delay and thus requires a different diagnostic process and a specific intervention approach if the concern is confirmed. As time permits, you may want to encourage questions so that you can dispel myths or uncover potential barriers that the family may face in taking the next steps. And you may consider giving voice to ambivalence. Setting expectations and providing coaching around navigating wait lists can be empowering for families, and some may require close follow-up to make sure that they're making these sort of difficult connections in this landscape of neurodevelopmental services. I'm going to turn it over to Dr. Hastings to talk with you some more about parent resources.
Thank you so much. As we know, unfortunately, there's a lot of wait lists for diagnostics related to autism as well as the treatment. And that can be really difficult for families that are waiting evaluations or treatment providers. So it's really important that new parent resources are coming out as often as possible to be able to get them more tools as they wait. In particular, the DCAC is providing these wonderful new resources for families, walking them through the process of what to expect from a diagnostic evaluation and what they can expect from a treatment aspect. In addition, information related to autism that is going to be available via flyers and online resources as well that will be able to be distributed, and it is coming soon. In addition to that, there are some really amazing resources online that we have been able to screen and are providing families that are awaiting, especially the treatment-based side of autism related care. And the ADEPT training is one that is out of UC Davis, and it's a module series for families to be able to access on their own time that targets two specific areas. One is going to be helping to improve their child's skill acquisition. And then the other is going to be ways and strategies to help with reducing problematic behavior within the home or community-based settings. And those resources are available, as we said, online for families, and they are free. They're also available in 5 different languages, which is incredibly helpful to the wide array of families that we see. In addition to that, there's some additional services that are available, as well as a book for an early start for a child that has been diagnosed by Sally Rogers, and additional authors as well that really walks families through some of the adjustment to the diagnosis, but really how to intervene with their child in a naturalistic way following the diagnosis of autism. We included a few additional resources, and then at Children's this past year, we have initiated for the past, 12 months, and then we're about to start our new one in July, a caregiver webinar series, which occurs from 12 to 1, the third Wednesday of the month, and we select different topics for the series. It's decided in advance, and parents can join one time, or they can join every single month. The majority of them are dedicated to topics related to autism, but also there are some topics that are more pertinent to children with neurodevelopmental disorders, ranging from sleep, transitioning to adulthood, as well as puberty, and how that it can be specific to children with autism and neurodevelopmental disorders in particular. We're going to move now to talking about a new initiative within Children's as well as in the community, which is called Echo Autism. Some of you may be familiar with Echo Autism, which started as more of a medical platform, a virtual learning environment with the motto, all teach, all learn. It's now expanded to mental health as well as education providers being able to access specialists from a learning environment that is via virtual or audio, and being able to access assistance and knowledge, and then be able to move into being able to share that with the families that they're seeing for as patients. And so the learning collaboratives that are currently being addressed within our Echo Autism through Children's specifically are related to primary care providers. We do one. We also do one with mental health providers. And then lastly, we started one with education providers and daycare providers in the community. So in a brief summary of Echo would be that we come together with medical specialists, myself as a psychologist, in addition to a multidisciplinary hub team. And there are currently 7 of us, several of which are within children's, but then we also have a social worker, developmental pediatrician, and speech and language pathologists that are from the community. We come together and are able to share from a specialty, be able to share information related to autism with a case presentation, in addition to being able to provide didactics and give recommendations. This is an example. It happens twice a month through children's, and we're able to offer free CMEs to medical doctors. There's a team support. We help with triaging and recommendations, and we do have a strong satisfaction currently for the past year of being able to provide this information. These are some sample didactics that we have presented on this past year, and then we will be running, this began in 2021. We are planning to do another 2 years, and some are specific to medical providers, and then others are going to be more specific to educators or mental health clinicians. Some of the sample didactics, as you'll see, are related to basic autism information, as well as early screenings of autism, how we do diagnostic evaluations, and then also a bit more detail related to how to help families navigate the system, and as well as transitioning them to adult care, which families are often find to be cumbersome. These are some dates for the next clinics. So the next one will be July to December for diagnostics. Pediatricians and primary care providers are encouraged and are welcome to join. In addition to that, we will have educators clinics, so that's for educators and daycare providers in January. And then we hope to have another PCP clinic that will run in January as well. Anyone can sign up via emailing our administrative assistant, Chelsea Armour. And we do also provide some information related to early screening for autism that can be done within a clinic using the STAT. And we hope that not only people will join to come to ours, but you also can do some of your own private learning through Vanderbilt, which is offering the STAT, which is generally about 12 items that can be administered in a pediatrician visit for about 20 minutes to give you a nice understanding of some of the early signs of autism and where to go from there in terms of referring. It is generally, if you're going through Vanderbilt, around $700 to do an individual provider, in addition to adding on additional providers within your practice. And it's generally about 2 to 4 hours for that training. I'm now going to transition into an integrated autism evals within children's.
Thanks. Yeah, I'm excited to talk with you today about this program that we've been integrating since 2019. So we hope that it'll give you some food for thought for your practices. And so the main goal of the program is to increase timely, equitable access to autism evaluations. As Melissa said, there's quite lengthy wait lists, and so we were trying to think about how to do this in a speedier fashion. And we also know that integrating evaluations can help us to reduce barriers to care for many families and increase closed loop communication with pediatricians. We hope that this aims to address the issue of autism prevalence increasing, concerns about workforce and waitlist growing, and limited access to specialty care. So we use autism experts from PSYD to really train and mentor integrated psychologists to diagnose clear-cut autism. And so given that we want to diagnose uncomplicated autism, we do target young children under 5 with a high likelihood of ASD. And in addition to PSYD, you can see our additional partners and note that we are in 3 Goldberg clinics currently. So in terms of how our program works, PCPs directly refer to us. They submitted a referral, and if we're not the right fit, we do aim to provide additional referral options. Most evaluations we do in 2 sessions, sometimes a little bit longer. The first session is a comprehensive interview with a caregiver that we do via telehealth, so that can be convenient and help to decrease no-shows. The second session we currently do in person, but we have done that remotely. And so during that visit, we do a direct observation with the child, either using the ADOS if we're doing it in person, or when we were doing it remotely, we use the tele-ASDP, which is a tool out of Vanderbilt. It's kind of a brief structured observational tool similar to the ADOS, but basically you coach the parent on prompts to do with the child while you observe. And then at the end of that observation visit is when we give the family feedback in terms of diagnostic impressions and recommendations. And then we close the loop with the pediatricians and document in the EMR. And we've also been doing care coordination to support families in next steps, given that we recognize the challenge of really navigating the complicated systems of referrals. So this slide highlights some of our program outcomes. And so far, we've managed to keep wait times down to less than about 3 months to completed evaluation. And you can see the sociodemographic variables of the families that we've been seeing. So mostly young children. As I said, that's really who we're targeting, predominantly Black, and 20% where English is not their primary language. And we're diagnosing autism in over 7 out of 10 cases. We do think the number will probably go up as we're doing more evals in person. We did have more cases, I think, that we ended up deferring diagnosis on when we were doing Zoom only. But yeah, hopefully we can be diagnosing more as we're seeing folks in person. And we have gotten PCP and parent survey data and more recently interview data that shows high rates of satisfaction with the program. And you can see a PCP code here that we included that really highlights their impressions of the program as improving health equity. And so here's a couple of lessons learned that we wanted to just highlight. We see the benefits of the work, but we have learned along the way. One of the big ones that we have realized is that being able to do autism evaluations quickly in primary care is great, and yet we also see a lot of families that may not be as prepared for the diagnosis. So we have families who kind of may decline the evaluation initially, sometimes several times. And but I think the nice thing in terms of being integrated is that we can work with the PCP, maybe defer diagnosis initially, make recommendations in terms of starting on things like speech therapy or child find before following up again. And then hopefully we can see them back eventually for that completed evaluation. And then the pediatrician can follow up with them during the next visit to continue the conversation, since we know that they all trust their PCPs, and so that has been really beneficial. We also have found that it can take some time to hone referrals in terms of assuring appropriateness for our crew to see versus when is it more appropriate to refer to CASD, like in more highly complex cases. It has taken some time to hone our skills in terms of pre-authorizations, and that has been an administrative burden that we've been working on. It's been nice that we have this partnership with several other different children's clinics, so we can kind of learn from one another on the pre-auth process for different insurance plans. And it can be challenging to figure out caseload and scheduling. The ADOS and some of those evaluations can take longer. So when you get a no-show, it is more impactful. But that's where we have really found care coordination is needed and so beneficial. I think Melissa mentioned earlier that it takes, we have found a long time to over 9 months on average that we're seeing to kind of connect families with more specialized insurance through their care coordination through their insurance. So that has been helpful, though is not billable. So it's just something else that we've learned. And then more recently, we've started to use the stat in some cases to support multi-stage screening and are considering integrating it into our workflow as a simpler, shorter tool that could make space to see more families. So we know that you are busy and appreciate your time. So we've just given you a couple of things to think about moving forward. If time is short, we hope that you will sign up for Echo Autism updates. If you have a little bit more time, then maybe downloading or bookmarking some of those autism e-resources and looking through those. Sharing feedback about the challenges you may be facing in navigating autism care. I'm going to share in a moment a survey link that we use to document these to help us with our advocacy efforts. And if you have a little bit more time, then perhaps considering attending an ECHO clinic, learning about the stat, or reaching us out to us. We have our contact information at the end and are happy to think with you a little bit more about how you might consider integrating autism evaluations into your clinics. So I'll pause there and we'll open it up for Q&A or for folks to share their own impressions of the system, things that you have found helpful. And again, I do have the survey link that we have there. This is something, it tends well, it's a little bit more DC specific, but if you have either positive or negatives about navigating neurodevelopmental concerns, we do appreciate that. That can really help us advocate within CHI. So we'll pause it there and open it up.
Thank you. We had a couple questions on the chat. The first one is, could you give us the link/info for the STAT training again, please? Where can they find the link for the STAT training?
Yes, that we can go back to. And then are these all posted? It should be in the.
Yeah,
Yeah.
we're going to post the slides
Okay.
online, so
So
I can
I can-
refer people to that.
Okay. Otherwise, I think we have it. Oh, there we go.
And I think you had your contact information here. There was a question about finding the phone number for the autism clinic, but I'm assuming that's probably on the website, right?
That would be on the neurodevelopmental landing page.
Okay, great. Thank you. Other questions? Last questions here on the chat, actually. Do you have clinics in Virginia? You do clinics in Virginia?
So I guess to clarify, so for the last program that I was talking about with the integrated evaluations, currently that's just in 3 Goldberg clinics. So it's not, so it's only open to providers within those specific Goldberg clinics. But I think CASD, I don't know if I'm-
And the Echo Autism would be available to any provider in the region. So they would be able to present a case if there was a diagnostic question that they wanted guidance on. Virginia, Maryland, DC are our primary, I would say, community outreach right now, but we would accept states even further.
Just for folks' awareness, not everyone knows what a Goldberg clinic is. At the hospital, there is a Goldberg Center for Community Pediatric Health, and so the hospital-based primary care health centers and programs are the Goldberg clinics. So they're sort of based in DC, serving a population of kids that live in the district that have been coming to hospital outpatient settings for years. I think what you're also appreciating, so for those of you who may not have quite as many years as I do and appreciate that more and more, we're not seeing otitis in our office. We're not seeing strep throats in our office. We're seeing behavior concerns. We're seeing autism. We are seeing suicide. We are seeing, that is what we are seeing more and more in our practice settings. And I think bit by bit, we are appreciating that much of how we are trained isn't giving us the skill set that we need to sort of manage our kids and families more successfully going forward. And so part of what we are trying to do at our network level, working with our pediatric practices and resources at the hospital and other resources in the community and the state AAP chapters, we are really trying to sort of figure out how we pull together the pieces, the early learning experiences, share some of that so that bit by bit we are able to better recognize and deliver better care. It is a work in progress. We actually have come quite a ways over the last couple of years, but we still have a lot of work to go.